are going to be recording this particular webinar for viewing later, and we're having guest speakers from Oregon Health Sciences University, Carly Bergier and Megan. I apologize, Megan, I don't remember your last name. Karam, okay. And we're very excited because this is a topic that our counselors have been asking for quite some time, and it looks like we have a fairly good attendance today, and then we also have quite a few people who may not have been able to participate at this particular time slot, but they usually will go to our website and review the recorded version. So with that, I will go ahead and turn it over to Megan and Carly.
Before we get started, really quick, just a couple of housekeeping things. If you are a SHIBA counselor, in the chat section, please put your name, the county that you serve, and that you're a SHIBA counselor in the chat section so that we can give you recertification credit. Or if you're a group, make sure that you list each individual who is watching with you today. And then also, I just wanted to let you know that we are expecting this to be one recertification credit. If you have any questions, please use the question and answer field at the bottom right-hand side, and we will address questions as we go, or have little breaks that we can ask our presenters the questions that you have let us know you have. And then at the top is the section where you can highlight the OHSU SHIBA file and then download file. And that way you can have a PDF of the slides that we're going over today. All right, I think we're ready to get going.
Hi everybody, this is Carly, and we're really excited to be talking with you about OHSU and the patients you assist with Medicare enrollment. So Megan is also here, obviously, and here we are. So I'm Carly and Megan, and we're kind of a dynamic duo. We are the only financial counselors at OHSU, and we actually are assigned specifically to two different oncology clinics, and we'll get to that in a few minutes. So Megan, do you want to talk about OHSU?
Sure. So I'm just kind of going to read from the slide, so about OHSU, so we are the only academic health center in Oregon, but we're also nationally distinct as a university dedicated solely to advancing health sciences. So we primarily use our resources to concentrate on research to prevent and cure disease, education to prepare physicians, dentists, nurses, etc., to succeed in evolving healthcare environment, patient care that incorporates the latest knowledge and discoveries. So we're based in Portland. We have about 16,000 employees. We operate the top-ranked adult and children's hospitals in Oregon. We have really competitive research funding of more than $400 million a year. As a public organization, we provide community outreach and services for Oregon's most vulnerable populations, which is really what Carly and I do for the two dedicated cancer clinics that we work for.
So some additional information, the Markham Hills campus in Portland has 36 major buildings, including OHSU Hospital, the Kohler Pavilion, and Dornbecker Children's Hospital. And it's also connected to the South Waterfront buildings by the Portland Aerial Tram, which is owned by the City of Portland and operated by OHSU. More about the South Waterfront campus. There are 3 major buildings, with 2 more opening in 2019, and the 2 that opened are Center for Health and Healing 2 and Rood Family Pavilion, which is operated by Ronald McDonald House and provides housing for patients who are traveling long distances to come for treatment at OHSU. There's the Center for Health and Healing, which was completed in 2006, and it's the nation's first large medical facility to earn the LEED Platinum certification for environmentally sustainable design and operations. The Robertson Life Sciences Building and Squirts Tower in 2014, and OHSU School of Dentistry with integrated spaces for students and faculty from OHSU, Portland State University, and Oregon State. And then the Night Cancer Research Building, which opened in 2018, which has 320,000 square feet of labs and collaborative spaces for hundreds of scientists. And then again, the two buildings that I mentioned that have actually already opened this year.
Also, there's a West Campus in Hillsboro. It's where OHSU's Primate Research Center is, and there's also the Vaccine and Gene Therapy Institute. A little bit about our patient demographics. 90% of our healthcare patients are from Oregon. Healthcare patients without insurance or covered by a public payer make up more than half of our visits. So clarifying our role, Carly talked about it a little bit. We primarily work with uninsured, underinsured, or patients transitioning to a different insurance. We specifically work with the Knight Cancer Institute, and we support hematology and medical oncology, and that does include bone marrow or stem cell transplant. There are over 200 clinics at OHSU, but these are the only clinics that we work for and provide support to. So like Carly said, we are the only financial counselors that we know of within OHSU. We don't think that any of the other clinics do have any type of role like ours.
So we have comprehensive and broad knowledge that we share with patients, and the purpose is to help patients and caregivers be more fully informed, to activate self-advocacy, and to refer patients to outside resources and expert assistance within the area in which they need assistance. And so, for example, SHIBA, we do a lot of referrals to SHIBA. We provide objective information and guidance only. We do not make specific recommendations to patients.
Hi, we have a quick question.
Sure.
On that previous, on the previous slide, you said you activate self-advocacy. Can you explain a little bit more what that means?
Yeah, so it's really important that patients and caregivers be oriented toward and empowered to playing an active role in decision making, becoming knowledgeable about diagnosis and treatment and health insurance benefits and how they're going to work, so that they can plan accordingly, necessarily on the personal finance side of things, how they're going to manage everything. And so part of this activating self-advocacy is us communicating that patients actually do, they are in the driver's seat. They may not recognize that they are, but they actually are. And so patients who ask questions, patients who engage with the provider, sometimes patients are overwhelmed and they don't feel that they can take that on in addition to coping with side effects from treatment or whatever, but it's really important that there be someone, if it's not the patient, someone close to the patient who's playing that role for them, because patients who advocate for themselves, people who advocate for themselves regardless of medical situation, kind of travel through life with better outcomes. It's about speaking up for oneself. Do you have anything to add to that, Megan?
That's what I was kind of hoping you were going to say, Carly. I know as SHIBA counselors, we do give our counselees sometimes directions. You know, if you go here, if you talk to your plan, or if you want to go to an agent, here are some questions to ask and get clarity before you are going to make a decision, because it could make a big impact on, you know, going forward. So we're in that same type of situation where we're trying to educate, but we're also giving people the language skills to ask the right questions and come back if they need to for further clarification.
Yes, and I think that that's actually hugely important, because a lot of people don't realize that it's perfectly acceptable to ask questions, and in fact, it's kind of critical to ask questions. So we do have no idea how their insurance functions. They have no idea whether or not they're fully insured or underinsured, or whether or not, like they may not even know what their out-of-pocket responsibility really is, and therefore have no plan for how, or if they're going to need help managing it. So it's the thing of, you know, if you are, for the most part, it seems that people who are either have more experience in healthcare on a personal level, and or people who have a higher education level already know the importance of asking questions, but the people who really need help are people who kind of, I think they expect to be told what to do rather than knowing that they need to decide for themselves what's going to be best.
I agree completely. In fact, today on NPR, they have a series called Your Big Bill. I don't know if anybody else heard that on their commute on the way in. The Your Big Bill segment today highlighted a person who had to have spinal surgery, and she had all of her surgeon, the hospital, everything was in network with her Blue Cross Blue Shield insurance. And then a year later, she got an EOB, an explanation of benefits from her insurance company, that she had almost a $94,000 neural monitoring bill that had just been processed, and her insurance only covered $800 of it, so she could be billed up to $93,000. So it's really, really important as counselors, obviously you are counselors too, that we make our counselees aware that sometimes these are really important questions to ask. Thankfully, Oregon does have a no surprise bill that was legislated, I believe, last year or maybe year before, so that our beneficiaries who have managed care plans are protected from having those out-of-network surprise bills hit them. But I'm sure that there will be situations where people are unaware that they are protected and they end up paying those bills, unfortunately.
Yes, and we actually do see that because we're also looking in at patient billing here at OHSU and have seen circumstances kind of like that, bills that should not have been sent to patients, that patients are paying not understanding that there was a mistake on the billing, and if the mistake isn't get caught, then patients are paying erroneously, and it's really difficult to get money refunded.
So as SHIBA counselors, I'm speaking to our counseling network here, one of the guidances that we can provide all of the people that we come in contact with is in arming them with that knowledge that it is perfectly acceptable for them to ask questions. It's perfectly acceptable for them to appeal certain determinations if they feel that it is inequitable, or outright, should not have been charged to them. And we want there to be somewhat of a sea change, because our society does not question the medical side of things in terms of the pricing. And we can question it. It's perfectly acceptable to question it and to get clarification. Thank you. That was a nice little discussion I wanted to have with the counselors.
Certainly.
Okay. So kind of going into why we refer to SHIBA. First of all, we love you. We have referred so many of our patients to you and have only heard really, really positive, good outcomes. So we definitely appreciate you being there and being available to our patients. We haven't received in-depth training specific to Medicare. We're not insurance agents. We don't really stay up to date on everything that's going on and changing, and aren't aware of all of the different Part B plans, all of the specifics. And so when we're able to refer our patients to you, they normally feel like they can trust you, that they feel at ease when they're making decisions. So we ultimately refer so that patients can make fully informed decisions about and be assisted with their Medicare enrollment. It's very complicated and nuanced. When our patients are going through treatment, oftentimes they're tired, they're sick. It's the last thing that they want to do. So having your services available is pretty amazing, so that everything can be broken down and explained to them. Most of our patients are undergoing treatment, like I just said, and they need to ensure that they secure the most complete coverage for the best price. Most of our patients are not insurance savvy. Who would want to be? And they appreciate the unbiased, objective recommendations. And like Carly said before, in our current role, we cannot advise patients on choosing one plan over another. And we also refer underinsured Medicare patients for possible enrollment in any applicable assistance program, like an MSP, an LIS, or if they might have a special enrollment period. We refer to you to see if there is something available for them. Do you have anything to add?
No, I think that's it. So how to best help OHSU patients? We suggest, we don't know if you already do this or not, but we recommend encouraging patients to create their individualized online Social Security account to view their current and or projected benefits. Many of our patients will wind up applying for Social Security disability. Also to encourage Medicare-eligible patients to create an account on Medicare.gov. If you already recommend this, we appreciate that very much. And then being mindful of the patient's medical issues and keeping in mind their out-of-pocket responsibility or potential for financial toxicity. So when we talk about underinsured patients, we're talking about those who have Medicare A and B only, patients who do not have a Part B, and or patients who have, let's say, a Medicare Advantage plan with out-of-pocket maximum that's unaffordable to them. So oftentimes, it's hard to anticipate. Generally, when we're making a referral to you, we would like to impress upon you the importance of the timely enrollment to make sure that people do have as best and complete enrollment in Medicare as possible to reduce the potential for financial toxicity.
So, again, how to best help OHSU patients. For network status, for Medicare Advantage plans, we are giving you, and hopefully or probably you already have these, our facility provider and MPI numbers so that you can look up plans to see that they're in network with us when you're helping patients specific to OHSU, or if they're wanting to double check and see if the plan that you're recommending is in network with whatever center they're seeing in their hometown as well as OHSU. Patients can request their specific doctor's and PI number from the clinic here at OHSU. It's definitely something that's made available to them. They just have to ask for it. And again, calling and verifying in-network status is very critical.
Can I interject
Yeah,
one thing? So on OHSU's website, ohsu.edu, there is a section for patient business services and billing. And on that, under patient business services and billing is a link that says something like insurances accepted at OHSU. And I just want to point out to you that that list is not complete and that list is not necessarily current, and that often the plans listed are actually out of network with OHSU. We haven't figured out why exactly. We haven't figured out how this could be better managed by the billing department. But this gets back to why it's very important that a call be made directly to the insurance company to verify the network status, and also, I just lost my train of thought, to verify the network status. And then on the other side, to understand that internally with oncology, there is a dedicated team of managed care coordinators who will submit to the insurance for an in-network exception, so that patients could be seen at an in-network rate, but that is no guarantee that the authorization is going to be given by the insurance company.
Carly, I'd like to tag along with some of your information. I've noticed that the billing pages do not accurately reflect the plans specifically that consider OHSU in their network. They do list insurance companies or carriers, but as we all know, those carriers serve a lot of different populations. They serve the Medicare population, the employer population, the marketplace population, the individual market. So it can be very subjective to the specific plan that person has enrolled in. So for instance, we might have two United Healthcare plans, and one is a PPO, one is an HMO, and we've seen, not necessarily at OHSU, but in Newburgh, the doctors take the HMO and the hospital takes the PPO. So it's really difficult because we have folks that want to have both their physicians and the hospital in network for both in one plan, and it's not available. So when we're talking to our clients as counselors, we need to make sure that they are contacting their specific plan carrier and asking that question, because under Medicare rules, plans are required to give their members accurate information at the time they call. If they're not providing accurate information, we need to know, because that is a violation of the contract under which those plans are held. So just so our counselors know, and so you and Megan know, that Medicare does put the responsibility on the carrier for those specific plans to determine whether or not a physician or a hospital is in or out of their network.
Thank you for that. And, you know, actually, it's made me think of another point, which is oftentimes the patient winds up feeling like a ping pong ball between the insurance company for their particular plan and OHSU. So where we've told the patient you need to confirm with the insurance company for your specific plan the network status with OHSU, and then the patient will call back and say, the insurance company told me that OHSU needs to tell me, and then we have to say, we're really sorry, but it has to come from the insurance company, because we don't have a way of actually confirming that. The insurance company will know what active contracts they have with OHSU, and the billing department here is, well, it wouldn't be the billing department, it would be like the contracting department, and they're not set up to navigate that with patients at all.
I agree. So certainly you can refer your folks to us, and our counselors who are on this call are now notified that the actual responsibility is the carriers of those plans contracted with Medicare.
Yes, and it's really important because the billing from OHSU is separated by professional billing and facility billing, and sometimes the insurance will be in network with the provider or the professional side, but out of network with the facility, and that's where the tax ID numbers come in really handy.
Yeah, that's exactly what I was illustrating with that Newbird. The hospital is in one plan and the in-network, and then the physicians are in the other. So it's very frustrating sometimes for the consumer.
Yeah.
So I think I was under Medicare A and B. Okay, so no concern there, Medicare A and B. If A and B are in network, then the supplement will also pay unless something is not a Medicare covered service. For Part D, obviously network status doesn't matter. What we are mainly looking for, again, we service cancer patients specifically, so searching plan formularies to make sure that the current or maybe future medications that they expect to be prescribed are covered, which I'm sure you guys do it already, and I know it's probably really time consuming, but it's a huge deal to our population of patients that we serve.
If they are going to be accessing an OHSU pharmacy, that would be something to factor into our plan search tools, because network status may matter depending on the plan and whether or not they are contracted as that network pharmacy.
Megan, do you want to talk about what happens with transplant patients and the fact that they need to be close to OHSU following?
Oh, so we do support hematology and medical oncology, but we are really hands-on with our transplant patients, bone marrow and stem cell. So during their transplant admission, they are normally here for a month, sometimes longer if there are complications. But post-transplant, they have to stay within how many miles?
I think it's 25 miles.
They have to stay within a really close proximity to OHSU for the first 100 days post-transplant, which can really, I don't even know how to say it.
Well, it hinders their ability, let's say, because they're staying here at OHSU or close by, they may not have the option of accessing their usual pharmacy, and they may wind up
OHSU's.
Yeah.
They normally use OHSU's pharmacy post 100 days because they are seen, I think the first 30 days they're seen every other day. They're here constantly, and then after that it normally drops off to a few times a week. But since they are here so frequently, they do use the OHSU pharmacies to fill their prescriptions. Post-transplant formularies that we normally give our patients, and you've probably seen those if you have helped any of our patients during or post-transplant, and they kind of show what will be expected or what's normally prescribed to patients who are going through transplant. It doesn't mean that they'll need them all, so it can be difficult to find a formulary that does include everything. So that can be difficult to navigate, to find a Part D that would include OHSU's pharmacy and then pharmacies close to their home. We definitely understand that, but that's kind of where it's at for our transplant patients and the timeline that they have staying close to OHSU. So that would be the main struggle you would see for Part D for them. Does anybody have any questions about that?
This is Donna again. The good news is that all of the Part D plans are statewide. Very few of them are not national. So most of them are national. The only one that I know of that's not national at the big box stores is Assurus. And so anybody who's coming from an outside of the Portland metro area for OHSU services should be able to translate those prescriptions to their home area if they're national in scope with the big box stores. When I say big box stores, I'm thinking Walgreens, Kroger, which is Fred Meyer here, Walmart, Rite Aid. Those are the big box pharmacy stores that generally will work no matter where somebody is coming from or to.
That's good to know.
Yeah.
I didn't know that.
I didn't know that either.
So common issues that we see, this is so typical where people have lived a good life and they've been healthy and haven't had any kind of issues at all, and therefore they think the rest of their life is going to go that way, and they opt out of either Part B or Part D or both, and they wind up being the patients who experience the greatest difficulty affording treatment due to the fact that they did opt out of coverage. And sometimes it's like the 85-year-old person who is diagnosed with cancer and didn't have Part D, and now they're going to have that, the extreme penalty should they enroll in a Part D plan. The other thing is that, patients don't understand that original Medicare only pays 80%, and so they didn't elect a supplement along with the guaranteed issue and have have difficulty finding a plan that they can enroll in after that fact. And here's like a weird sort of a scenario. I was working with a gentleman who he had a transplant previously. His wife also has significant health issues, and they were fully insured, both of them, with Medicare A, B, D, and an excellent supplement. And she felt so badly that she wasn't able to help with more of what was going on, and he actually had to go back to work to help them make ends meet. And so he designated that she could take over payment of the Medicare premiums, and she lost track of it, and as a result they lost their supplement, and then wound up with this 20% responsibility, with both of them having major health issues. And so it took a long time, but he wound up finding another supplement that they could enroll in, and so now they are fully insured again, but it was a very, very stressful period of time for them.
So more common issues that we see, patients will end up with a coverage gap because of being uncertain of the actual effective date of their Medicare, usually disability related. So sometimes, like in one of our previous slides, most, if not all of our patients usually do try to apply for Social Security disability. And again, it's really complicated, and they don't realize that if they're approved for that at some point they will be able to enroll in Medicare. They don't keep up with the effective date or when that will happen. If they are here for treatment and they're commuting to and from home and they don't have anybody checking their mail, the time frame comes, it passes, they're not aware. So that's why we really would love if you would, I'm sure that you do already, but if you would just recommend that they sign up for SSA.gov or Medicare.gov so that they do have an online portal that they can reference if they're not able to be home and check their mail. Patients are not aware that Part D may not cover their prescriptions, and patients will sometimes be enrolled in an assistance program and will have no idea that they are and what the associated benefits are. And Carly and I see this all the time. We'll call patients and expecting to know that they are enrolled in a Medicare savings program, and they are like, what's that? I didn't know that I had QMB. I didn't know that I had the low-income subsidy for Part D. So it's actually pretty amazing how often we come across patients who are enrolled in these programs and have no idea how it happened or who even helped them apply for it.
And we should point out to you, so that you know this, that if a patient qualifies for SMB or SMF, they qualify automatically for 100% financial assistance from OHSU, which means then that their out-of-pocket responsibility associated with Medicare is zero. But if they don't know that they have that benefit, they don't know when they receive a bill that they can call the billing department and ask them to apply the financial assistance to their bill.
That is awesome. That is going to make a huge difference in our counseling. So thank you for that. Yeah.
Yeah, ideally, when I first started working here, I was thinking, well, how can somebody have automatic 100% financial assistance, meaning they didn't have to apply for it and they have it? How are they receiving bills? And the problem is that the billing is automated and it's not linked to a time when some person goes in and makes those manual adjustments of financial assistance. So we actually have seen people with 100% financial assistance be sent to collections.
Wow. And does this apply to both the clinics, physicians, and the facility, or subsets?
All across the board.
Oh, wonderful. Wow, that is just wonderful.
So that being said,
I got people
remember
in mind.
that we're referencing the 2 clinics that we work at. We're not 100% certain that every clinic at OHSU accepts financial assistance. So
Okay.
just a little catch that the patient will want to verify.
Yeah.
Okay,
Yeah.
so it could be clinic specific.
Yes.
Okay.
In oncology, across the board, regardless of which clinic it is, so radiation oncology, surgical oncology, neuro-oncology, whatever, they all accept financial assistance.
Yeah.
Wonderful. Okay, that's good to know.
Okay, so that's basically what we had thought, would be good background for you guys, and, we've dedicated the rest of the time to questions.
So this is Donna. I'm going to jump in first. Any other financial assistance programs that are OHSU globally, or is it all going to be clinic specific based on health situation?
So patients can apply for financial assistance, and it is global. We do have a financial assistance policy, which basically follows OHP, and anything, I always mix it up, anything that's below the line would be covered. So anything that's OHP covered would be covered by OHSU's financial assistance. So anything that's not covered by OHP would not be covered under OHSU's 100 or 65% financial assistance. So it's when patients apply, we're moving towards a automatic application for certain people that call into registration to be screened for financial assistance. So applications might not be needed, hopefully in the near future. And it's awarded at either 100% or 65%. And outside of the OHP guidelines that it follows, it doesn't cover anything that would be considered, and it just
Elective.
my mind, elective.
Elective, yeah.
There's also, we offer interest-free payment plans. That's global too. Patients can call in to billing and request an interest-free payment plan. And on my chart, they've started to build in creating payment plans on my chart, but we still recommend at this time calling into billing and doing it over the phone. And then
they can also, so if for some reason a patient or a service is self-pay, considered self-pay, then OHSU automatically discounts the charge by 35%. In addition to that, if someone's calling the billing department, if they're prepared to pay a balance in full over the phone with a credit card, they can ask if there's a prompt pay discount.
Okay. Pay. Great. I was taking some notes. We've unmuted everybody.
Would you like the phone number for OHSU registration, and would you like a phone number? And so there's the number for the billing department is printed on the billing statement. It is an outside contracted call center, and the staff there only have so much authority to negotiate and put together payment plans. We can give you the internal phone line where the staff have greater latitude with the payment plans.
And shorter wait
Yes,
time.
please.
And shorter wait times, okay. So patient business services and or the billing department, the phone number is 503-494-8760, and they're open Monday through Friday from 9 to 4:30.
Okay.
And then
That's the internal.
registration, that's the internal number.
Okay.
Registration services, actually this number is really important for you too, for two reasons. One, when people have new coverage that they want to add to their insurance so that OHSU can bill it. So let's say they enroll in Medicare or a Medicare Advantage plan, they need to call registration to give them the insurance information. But they also can call, while they're on that call, they can ask to be screened for financial assistance from OHSU.
Okay.
And that number for registration is 503-494-8505. And
Okay.
the guideline, the upper threshold is 400% of the federal poverty level.
Okay. So 400% or below?
400% and below.
And below. Okay. Very good. And we have a question from Steve, where to get more info on Oregon's No Surprise bill. I'll have to go look in the legislative information. We can maybe put that out on the website with the recorded version with the handouts when I find it.
I can put the link.
Okay, Megan's going to attach a link also into the chat box, because on our billing it actually has a little, on the billing page, it has information.
Oh, good.
That says, oh, not balance bill, and here's the thing about the surprise medical bills.
Great. Thank you.
Yeah. And the other thing, I don't know if patients actually do ever talk with you about outstanding bills that they have. Interestingly, something, I'm trying to remember how this patient got brought to our attention. It probably, it was a billing issue. It was a long-time patient that I have worked with who actually lived in County, Washington, and is participating in a clinical trial at OHSU. It is the only treatment that is effective against her cancer, and it's not available anywhere else. And she got this really high bill, and she's on a marketplace, a Washington marketplace plan, but her out-of-pocket maximum is $1,200, and she received this bill for like $5,400. And it turned out that it was a balanced billing situation, like a mistake on billing's part that hadn't been caught. And so those charges have been reversed. But the guidance is, if anybody does mention, I've got high bills, they really do need to reach out to the billing department and ask for guidance, and also contact their insurance company and ask them to explain how it is that they have these high bills.
Yes, absolutely. Again, we should always be counseling our clients to question anything that they either don't understand or do not feel is reasonable or is a surprise to them, because it could be an error. And
Yeah.
I did just Google No Surprise Bill Oregon and came up with a link on the Oregon.gov website that we will be posting here in just a second. It might be the same one that Megan put up. Yep, it's the same room, same one. Newsroom?
Uh-huh.
Okay, so it's the same one. So yeah, that's a good link with information. Everybody's unmuted. Anybody else have any questions or thoughts they would like to share? Situations that they would like Carly or Megan to help with? Okay, having heard none. Thank you, Carly and Megan, so very much. We are very, very pleased to have you on the call with us, and we really appreciate the referrals and any assistance that we can provide with the folks that you're dealing with. We understand that their situations are sometimes very precarious, and they need some calm guidance to help them through this. So we appreciate you as much as you appreciate us.
Thank you guys so much for being with us today.
Oh,
Of course.
yes, it's our pleasure, and if we just could say to you that we again so appreciate being able to work with you and have a sense that there's not so much really separation between us, but that it's almost as though I don't exactly know how to explain it. Not that you work for OHSU, but we don't really sense any separation between us, and it's like a warm transfer of care over to you and then from you back to us. So it's a really great thing, and we're so happy to be connected with you.
Yes, we appreciate you very, very much.
Well, ditto. All right, well, folks, if you think of any other things that you want to ask, we can certainly get the questions or comments to Carly and Megan, and maybe we'll invite them back next year this time as part of our monthly enrichment webinars. So thank you again, everybody, for participating today.